let's say you're a clinic, you've got one location, maybe you have two locations, we'll call it one location, make it easy. You've got one location, you've got 30 people employed in that clinic. 20 of them are patient facing in a clinical sense. 10 of them are rotating door of administration, front office, back office on the business side, probably a practice manager as well. That clinic, let's say they've got 6 or 7 treatment rooms, maybe 8 treatment rooms. They're probably doing somewhere around £1.5 or £2 million a year in annualized turnover. And let's say that the average treatment price is around £200. So they're seeing thousands of patients a year, not tens of thousands of patients, thousands of patients a year. We usually think that about, say it's 1,000 patients a year, we usually think that about 700 of those are off track. They're not doing what they should be doing, not because they're bad, but because they're just not following the happy path all the way through. So you put a price tag on one patient who falls off track over the course of a year, it's probably £300 or £400. One patient. Now you've got 700 of those patients every year. Now, are they all going to come back? No. Like, you're not going to get full recall of that patient body. Of course not. And you don't want them either, right? Some people have a medical condition, you treat them, they go away, they're happy, they're healthy, you've done your job. But many people abandon that journey, especially in physiotherapy, chiropractic. Your knee feels good enough, but not actually good. And so you just disengage. So 100 people of the 700 maybe could be brought back to the clinic. So that's 100 times 300 or 400. For a small business, that's tens of thousands of pounds. That's the difference between comfortably making salary each month and worrying about the summer months. So a fundamentally different way of operating as a business when you know you have that reliable cash flow. People try to solve that now with memberships, recurring payment, recurring payment, recurring payment. But the root cause is that you've got patients that you're working really hard to get interest from and then losing them way too early. And there's no system in place to solve that. It's not a buttons problem. It's not let me press the button that gets the people back. This is about re-engagement. It's a very time-intensive, very complex exercise. It's hard to do as a clinic.